Can a pancreas MRI tell apart pancreatitis and cancer? Imagine trying to tell two very similar twins apart just by looking at their pictures. That's kind of what doctors face when they use MRI scans to differentiate between pancreatitis and pancreatic cancer. Both conditions can cause similar symptoms like abdominal pain, weight loss, and jaundice, and their imaging features often overlap too. Magnetic resonance imaging of the pancreas is a powerful tool that provides detailed pictures of the organ's structure and tissue characteristics. It can show if there is a mass, inflammation, or other abnormalities. But when it comes to telling pancreatitis from cancer, MRI alone has its limits. For example, pancreatic cancer, especially the common ductal adenocarcinoma, usually appears as a darker, less blood-rich mass that may have a fibrous, dense tissue component. It often shows delayed enhancement on MRI because of this fibrous tissue. On the other hand, mass-forming pancreatitis can look very similar, with localized inflammation, fibrosis, and sometimes a mass-like appearance. Both conditions can cause ductal blockage and secondary signs like duct dilation or tissue atrophy, making them hard to tell apart just by looking at the images. Researchers have looked into advanced MRI techniques like diffusion-weighted imaging, which measures water movement within tissues. While this can sometimes help, it does not reliably distinguish cancer from chronic pancreatitis because both can show similar diffusion patterns. The apparent diffusion coefficient values often overlap, meaning the technique isn't definitive on its own. Combining MRI with other imaging methods, such as magnetic resonance cholangiopancreatography or computed tomography, can improve diagnostic accuracy. Still, even with multiple imaging tools, misdiagnosis can happen, especially when the mass looks suspicious but isn't clearly one or the other. That's why doctors often need to perform endoscopic ultrasound with fine needle biopsy. This procedure allows them to take tissue samples for microscopic examination, which provides a more definitive diagnosis than imaging alone. Clinical signs and additional features also help guide diagnosis. For instance, if a well-defined mass is seen, it might suggest cancer, but this isn't always certain. Signs like vascular invasion or necrosis seen on imaging can point toward cancer, but they are not exclusive to it. Pancreatitis might show calcifications, pseudocysts, or stones in the ducts, which are less common in cancer. The double duct sign, where both the pancreatic and bile ducts are dilated, can occur in both conditions, so it's not a reliable distinguishing feature. In practice, MRI is very useful for characterizing pancreatic lesions, especially cystic ones, and for staging known cancers to see if they can be surgically removed. However, because of the overlapping features, MRI findings that raise suspicion for cancer should be followed up with additional tests, including tissue biopsy, to confirm the diagnosis. Early and accurate differentiation is crucial because the treatment approaches for pancreatitis and pancreatic cancer are very different. In summary, while MRI provides detailed images and valuable information about the pancreas, it cannot definitively tell apart pancreatitis from pancreatic cancer on its own. The overlap in imaging features means that a comprehensive approach, combining clinical evaluation, multiple imaging techniques, and tissue sampling, is essential for an accurate diagnosis. Always consult healthcare professionals for personalized assessment and management, as each case can vary widely.